Well, my favorite thing about this particular EHR practice partner is that I can use the dot codes and the bright note technology to type something once and it goes all the places in the chart that I want it to go, and I don't have to repeat it several times. I don't have to put allergy to this, it goes over here. If I type allergy to this in the correct way, it goes to all the different places in the chart that it belongs. And that has to be one of my very favorite ones. The other thing is the versatility, of practice partner. If I want to change my template, I can do it on the spot. If I want to dictate, I could do it if I want to. If I want to do dragon, or we've done dragon, but if I want to, I could do that, and so it's very, very versatile. I love the versatility. You know what, this practice would not be as successful as it is with EHR without the templates. That was very key, to our success. Because one of the hard things, of course, is documentation. The vitals are great and the medication lists are great, and all those things, but how do you document that patient visit? And we had a lot of consternation about the best way to do it, and we did have physicians who kept dictating for some time, which was our previous style. But once we had templates that were more usable, because once we got out of the box, they just weren't usable for us. They weren't our style. They didn't have the things that we needed. So once we started developing those, then everybody stopped dictating and just using templates. And we create new templates all the time, based on our need. So it was critical, to our success. I think that all medical officers should go to EHR. It improves efficiency, it improves quality, improves patient care, decreases errors in patient care. And eventually we'll be able to talk to each other with our EHRs about the patients, that we'll be able to send, hopefully, our notes directly to the specialist. We'll be able to access the hospital records when we need them, and that will tremendously improve the quality of the patient care. I think that for an EHR to be successful, that the doctors have got to take the lead. If the doctors don't take the lead, then nobody's going to follow. An office manager can tell everybody what to do, but if the doctors aren't on board, it's just not going to happen. So they have got to be on board with it. They've got to make a commitment. It's hard work for the first 6 months probably, but after those 6 months, your life is so much better. And so you just have to make a commitment and say, this is what we want to do, and we're going to do it. There'll be roadblocks, and you just have to go around them or over them or under them. And then, but once you get to where you need to be and very proficient at things and get rid of your paper charts, your life is going to be so delightful compared to what it was before. I think if I was having to give somebody advice about an EHR, and if they were trying to decide whether to do an EHR or how to do an EHR, my advice is to research your EHRs. Pick one that seems the best for you. Of course, I think Practice Partner is better for everybody because it's so versatile and has so many more things that some of the other EHRs don't have. And then to just jump in and do it, and not to be afraid. Because you know what, you can always, we sometimes would go forward with something and go, oh, we're not ready for that. We would step back and do it the old way. But you always can go back to the way you did it for a little while and then move forward with that thing again. Or, oh, we didn't do that the right way. This doesn't work. Let's go back. Patient care was never compromised. We always had good records. Sometimes they were a combination of EHR and paper, but you can't plan for every single eventuality. So I would advise not to spend years and years of planning, for every single thing that can go wrong, because you don't even know what's going to go wrong, or what's going to happen, or maybe what system you didn't think of that you needed. We've invented lots of things along the way that we didn't even imagine we would need, and our EHR helped us to be able to do that. We would find a need and say, oh, we're tired of doing that all the time, let's do this. So we'd make a letter template, or we'd make a message template, or we would do something else, to improve our life.